Any difficulty in study? Relax. Dental Anupam is here. Uh, Today topic or chapter is the musculature of the head and neck. Today we covered the most important muscles of mastication, muscles of facial expression, muscles of soft palate, muscles of tongue, muscles of eye, and muscles of floor of the mouth. Overview. Myology is the study of muscles, their structures and functions. Muscle is contractile tissue of animals derived from mesodermal layer of embryonic germ cell. Muscles can be classified into skeletal, smooth, and cardiac muscle based on histology and into voluntary and involuntary based on the actions. The muscles of the head region include uh, muscles of eye, nose, mouth, and ears. The major muscles of the eye are rectus muscles, oblique muscles, and levator muscles. The major group of muscles uh, in the around the mouth are muscle of mastications and muscles of facial expression. Each group of muscles process specific neural and vascular supply and also specific action which all play in synchrony to uh, produce the desired effect that is controlled by nervous system through the afferent and efferent pathway. Afferent means sensory nerve and efferent means motor neuron. To to play their role into perfection, muscles are overflow with rich vascularization. Introduction. Myology is the study of muscles, their structures and functions. Muscles is the contractile tissue of animals derived from mesodermal layer of embryonic germ cell. The anatomy of muscles is the basis for understanding the function of muscles and the clinical correction of muscle related disease. Muscle anatomy include gross as well as microanatomy. Gross anatomy is the study of the overall muscles, its origin, insertion, actions, and nerve supply. Where microanatomy is the study of a single muscle fiber, the basic terms and definitions a student has to be familiar with for food good understanding of anatomy and function of muscle. Now go to the basic terminology of muscles. Tendon. dense connective tissue that binds a muscle to periosteum of the bone. Skeletal muscles is attached to the bone by the tendon. Aponeurosis. Flattened sheet-like tendon called aponeurosis. Raphe. A ridge or line where muscle fibers meet and partially interlace. Fascia. Fibrous connective tissue that drapes muscles and fuse to the skin. It has two components, superficial and deep. Superficial fascia. It's attached skin to deeper structure. The thick end of the superficial fascia varies depend on the origin. It is the thick over the anatomical wall, whereas it is thin in facial region. Deep fascia. It is the deeper component of the superficial fascia. This merge with the epimysium of muscle. Endomysium. Thin sheet of connective tissue surrounding individual muscle fiber which bind muscle fiber together. Paramesium. Connective tissue that encompasses group of muscles fiber together into bundle called fasciculi. Paramecium supports the neurovascular components which supply the various fasciculi. Epimysium covering the entire muscles which is continuous with a tendon. Classification of muscles. On the basis of histology, muscles are three types: skeletal muscle, smooth muscles, and cardiac muscle. Skeletal muscles. Skeletal muscles are anchored by the tendon or by aponeurosis to the bone. They initiated skeletal movement such as locomotion and maintaining posture. Microscopically, they appear as alternating light and dark band that give the characteristic straighted appearance. Therefore, they are also referred to as straighted muscle. Facial muscles are skeletal muscles. Smooth muscles. Smooth muscles are found within the wall of organs and structures such as esophagus, intestine, bronchi, and blood vessels. They are non-straighted. Straighted muscles contract and relax in short, incent bursts, where smooth muscle sustained longer contractions. Cardiac muscles. Cardiac muscles is found only in the heart. It connects the branching and irregular angles. On the basis of movement, muscles are of two types: voluntary, involuntary. Voluntary muscles under conscious control, for example, skeletal muscles. Involuntary muscle are not under conscious control, for example, smooth muscle and cardiac muscle. On the basis of muscle muscle architecture, variation in the arrangement of muscles fiber renders characteristics functional features. They are different observed. Those are parallel, convergent, sphincteric, and pinnate. Blood and nerve supply to skeletal muscles. The the high metabolic activity in the muscles demands rich vascularity to the nourish the muscle cell with the oxygen and nutrients, and also to clear off the metabolic waste. The capillary exchange of gas and nutrients between the arteries and veins occurs at the endomysium level. Skeletal muscle fiber contract only when the stimulated by a nerve impulse. Therefore, an extensive network of nerve is present to initiate muscular action. Every muscle receives two types of nerves: sensory afferent neuron and motor efferent neuron. Sensory neuron, nerve cell that carries impulse from muscle fiber to central nervous system. Efferent neuron, new nerve cell that carries impulse or commands from central nervous system to the muscle fiber, stimulating it to contract. Muscles of the head region. In muscles of the head region can be studied under the subgroups which are based on their anatomical site and function. Muscles of facial expression, muscles of mastication, muscles of soft palate, muscles of tongue, muscles of eye, and muscles of the floor of the mouth. Muscles of facial expression. Important muscles. Facial muscles are the subcutaneous striated muscles that surrounded and regulated the functions of four natural openings on the face, namely the oral cavity, the nasal cavity, and two orbit. There are two types: compressors, which close to the close the opening, and dilator, which open the apparatus. The facial muscles play significant role in controlling the facial opening, depressing various emotion, deglutition, speech. The facial muscles are grouped according to their location. Muscle related the eye or eye related muscle. Orbicularis oculi, quadrangulator supercilii, levator palpebrae superioris. Muscles related to nose, procerus, compressor nares, dilator nares, depressor septi. Muscle related to mouth, orbicularis oris, buccinator, zygomaticus major, zygomaticus minor, rhizoras, levator levi superioris, levator levi superioris alaquic nasi, depressor levi inferioris, levator anguli oris, mentalis, depressor anguli oris. And last one is the muscle related to ears, anterior, superior, and posterior auricular muscles. Now go to the which muscle shows which expression. The uh, expression with muscle. Which muscle contract or relax and go to the expression result. Muscle contract or relax and result is the expression. First one is smiling or laughing, zygomaticus major muscle. Doubt, mentalis. Sadness, levator levi superioris. Grinning, rhizoras. Grief, depressor anguli oris. Contempt, zygomaticus minor. Anger, dilator nares, depressor septi. Closing mouth, orbicularis oris. Forming, corrugator supercilii procerus. Horror, fright, platysma. Whistling, buccinator orbicularis oris. Surprise, frontalis. Now we discuss the origin and insertion of some prominent muscles of expressions. First one is orbicularis oculi. This is the sphincter muscle of the eye. It has three parts: orbital, palpebral, and lacrimal. The orbital part is present around the orbital margin. The orbital part originate from the medial part of the medial palpebral ligament and the adjoining bone, runs as a concentric circle and return to the point of origin. The palpebral part start from the lateral part of the medial palpebral ligament and insert into the lateral palpebral raphe. The lacrimal part originate from the lacrimal fascia and the lacrimal bone and insert into the upper and lower eyelids. It's help in dilating the lacrimal sac. Second one is orbicularis oris. Orbicularis oris is the sphincter muscles of mouth comprising two parts, intrinsic and extrinsic. The intrinsic part is derived from the superior incivus of the maxilla and the inferior incivus of the mandible. They become inserted into the angle of the mouth. The extrinsic part is derived from converging muscles such as buccinator, elevator, and depressor of the lips and their angles. Those are inserted into the lips and angle of the mouth. Third one is buccinator. Buccinator is the muscle of cheek. The muscle fiber are derived from three sources: upper fiber, lower fiber, and middle fiber. Upper fiber. Those originated from the maxilla opposite the molar teeth and insert into upper lip. Lower fibers. Those originated from the mandible opposite the molar teeth and insert into the lower lip. Middle fiber. Those originated from the pterygomandibular raphe and finally insert into the lip. Innervation and blood supply of muscles of facial expression. Motor. The facial muscles are derived from the second brachial arch. Therefore, the motor supply to the facial muscles is by the branch of the facial nerve. Sensory. Sensory innervation is by the branch of trigeminal nerve. Vascularity. Vascularity to the face is provided by the facial artery and transverse facial artery. Muscle of mastication. Muscle of mastication are related to the jaws and the responsible for the masticatory function and speech. They are four in number on their side: masseter, medial pterygoid, lateral pterygoid, and temporalis. The muscle of mastication is most important muscles of our subject. First one is the masseter. Masseter is a quadrilateral shaped muscle located on the lateral surface of the ramus of the mandible and originate at three different layers: superficial layer, middle layer, and deep layer. Superficial layer. Superficial layer is the biggest layer and originated from the anterior two-thirds of the lower border of the zygomatic arch and the adjacent zygomatic process of the maxilla. It runs downwards and posteriorly at 45 degree into the lower lateral surface of the mandibular ramus. Middle layer. Middle layer of masseter it begin from the deeper surface of the anterior two-thirds of the zygomatic arch and posterior one-third. Those run vertically downwards to become inserted into the middle part of ramus. Deep layer. Deep layer of masseter originated from the deep surface of the zygomatic arch, descend vertically and insert into the upper part of the ramus and the coronoid process. Action of masseter is elevate mandible and motor supply of masseter is branch from main trunk of mandibular nerve. Now go to the medial pterygoid. Medial pterygoid has a superficial and deep head. Superficial head is small and arises from the maxillary tuberosity, and deep head is large and arises from the medial surface of the lateral pterygoid plate and adjoining process of the palatine bone. All fibers are inserted into the roughened area on the medial surface of mandibular angle and ramus. Action of medial pterygoid is elevate mandible, and nerve supply of medial pterygoid is branch from main trunk of mandibular nerve. Now go to the lateral pterygoid. Lateral pterygoid two has two heads, upper head and lower head. Upper head arises from infratemporal surface and the crest of greater wing of the sphenoid. Lower head of lateral pterygoid has or is from the lateral surface of the lateral pterygoid plate. The fibers of both heads converge and the becomes inserted into pterygoid fovea present at the neck of the mandible and anterior margin of articular discs and capsule of the temporomandibular joint. Temporalis. Lateral pterygoid muscles actions is depressed mandible and grinding movement, and motor nerve supply is branch from anterior division of mandibular nerve. Temporalis muscle. The origin of temporalis muscle, fan shape muscles, is the temporalis, temporal fossa, and temporal fascia. Fibers pass deep to zygomatic arch and insert into the coronoid process and the anterior border of the ramus. The action of all muscles of mastication are elevation and depression of mandible. Now the innervation and the blood supply of the muscle of mastication. Motor supply. Motor supply is provided by the muscular branch of mandibular nerve. Sensory supply is by the trigeminal nerve, and the vascularity of the muscles of the mastication is maintained by the second part of maxillary artery. Now go to the muscles of the soft palate. Soft palate or muscular palate compresses muscle shaded by the mucous membrane which hangs down from the posterior aspect of the hard palate. It acts as a movable gateway between the oropharynx and nasopharynx, closing one during the uses of others. The muscles which constitute the soft palate are paired and are five in number. The important function of muscles are speech, deglutition, respiration, and reflex such as coughing and sneezing. The muscles of the soft palate are follows: tensor palatini or tension valley palatini, levator palati or levator valley palatini, musculus evalue, palatoglossus and palatopharyngeus. tensor palati or tension valley palatini. Tensor palati is the primary muscles of the soft palate. It originated from the lateral side of the auditory tube and adjoining region of the sphenoid bone. It runs down, forming a narrow tendon that winds around the pterygoid hamulus. Later, it broadens out to from the palatine aponeurosis in the midline to joint with the same of the opposite side. Anteriorly, it attaches to the posterior border of the hard palate. On contraction, it tightens the soft palate, especially the anterior part, and open up the auditory tube. Action of levator valley palatini: elevate soft palate and open auditory tube. And motor supply is 9 via 10. Levator palati or levator valley palatini. The levator palati originated from the inferior aspect of the auditory tube and the inferior surface of the adjoining part of the petrous temporal bone. It is cylindrical in shape and lies deeper to the tensor palati. The muscle passes over the superior constrictor and inserted into the upper surface of palatine aponeurosis. Its action are elevation of soft palate and opening of the auditory tube, and nerve supply is mandibular nerve. Musculus evali. The musculus evali lies within the palatine aponeurosis. It starts from the posterior nasal spine and become insert into the mucous membrane of the uvula. It helps in the pulling of the uvula. Palatoglossus. Palatoglossus is the discuss and it start from the oral surface of the palatine aponeurosis. It descend the palatoglossal arch to the lateral side of the tongue. Palatoglossus actions is pull up tongue and motor supply is ninth cranial nerve via 10 cranial nerve. Palatopharyngeus. The palatopharyngeus consists of two fasciculi, anterior fasciculus and posterior fasciculus. Anterior fasciculus originating at the posterior border of the hard palate. Posterior fasciculus originated from the palatine aponeurosis. Those fasciculi descend into the palatopharyngeal arch and become insert into the posterior border of the thyroid cartilage and pharyngeal wall. Some of the fibers of palatopharyngeus form a sphincter deep to the superior constrictor at the level of hard palate. These constitute these muscles on the contraction produce a ridge on the posterior wall of pharynx, which encounters the elevated soft palate. This helps in the closure of pharyngeal stimulus when necessary. The actions of palatopharyngeals is pull up pharynx and motor supply is ninth cranial nerve through 10 cranial nerve. Now go to the innervation and blood supply of the muscles of soft palate. Motor. Motor supply to all the muscle except tensor palatini is by pharyngeal plexus derived from cranial part of accessory nerve through the vagus nerve. The tensor palatini is supplied by mandibular nerve. Sensor. Sensor innervation of two types. The general sensation is provided by the middle and posterior nasal palatine nerves and glossopharyngeal nerve. And the artery supply of the soft palate is from the three sources: greater palatine artery, ascending palatine artery, and palatine artery. Greater palatine artery is the branch of maxillary artery. Ascending palatine artery is the branch of facial artery, and palatine artery is the branch of ascending pharyngeal artery. Venous drainage is by the corresponding veins to the pterygoid and tensular plexus of veins. Muscle of tongue. The tongue is an important organ for the speech and deglution. A median fibrous septum divides the tongue into right and left halves. Each half has two types of muscle: extrinsic muscle and intrinsic muscle. Extrinsic muscle. Those are paired muscles, four in number on either side. They protrude, retract, depress, and elevate the tongue. The descriptions are: first one is genioglossus. It is the muscle which from the major bulk of the tongue. It arises from the genial tubercle on the present on the medial surface of the mandible. Fans out and is divided into the three bundle of fibers to the insert into the tongue at the three different regions. The upper fiber are inserted into the tip, middle fiber into the dorsum, and lower fiber into the hyoid bone. Each group has distinct functions. The upper fibers retract the teeth and middle fibers depress the tongue, and lower fibers help in the protrusion of the tongues. Hyloglossus. Hyloglossus originated along the whole length of greater cornu and lateral part of the body of the hyoid bone. It ascends upward and forward to insert into the lateral aspect of the tongue between the styloglossus and the inferior longitudinal muscles. The action of the muscles are depression and retraction of a protrude tongue. Styloglossus. This is a long strip of muscle originated from the tip and anterior border of the styloid process as well as upper end of the stylohyoid ligament. It runs from forward and downwards to inter- interspice the with the fibers of hyoglossus. It is the active during swallowing and it pulls the tongue upward and backward. Palatoglossus. Palatoglossus muscles start from the oral surface of palatine aponeurosis. It descends the palatoglossal arch to the lateral side of the tongue. It approximates the palatoglossal arch, thus helping in the closure of oropharyngeal isthmus. Now, the intrinsic muscles. Intrinsic muscles refer to muscles that lie entirely with the tongue, whereas extrinsic muscles refer to those which attach the tongue to the adjacent structures. They originated from the adjacent bony structures and insert into the tongue. There are four pairs of intrinsic muscles that originated and insert within the tongue running along its length. The intrinsic muscle modify the shape of the tongue for various functions such as talking, swallowing, whereas the extrinsic muscles alter the position of the tongue. The intrinsic muscles are follows: superior longitudinal, inferior longitudinal, vertical, and transverse. Those muscles lie in the upper part of the tongue and are attached to the submucous fibers layer and the medial septum. The transverse muscle fiber are seen only in cross section as transverse dot running under the longitudinal muscles. Now the innervation and the blood supply of muscles of the tongue. Motor supply. Motor supply is the through the hypoglossal nerve. All intrinsic and extrinsic muscles of the tongue are supplied by the hypoglossal nerve. 12 cranial nerve, except palatoglossus, which is innervated by the 10 cranial nerve through the pharyngeal plexus. Sensory. Sensory supply is through different nerve generation. Sensation of the anterior two-third is supplied by the lingual nerve, which is a branch of mandibular nerve V3. The trigeminal nerve, fifth cranial nerve. The taste for the anterior two-third of the tongue is supplied by the facial nerve, seventh cranial nerve. Taste as well as general sensation for posterior one-third is supplied by glossopharyngeal nerve, which is ninth cranial nerve. The tongue received blood supply from two sources, primary source and second source. Primary source is lingual artery, branch of the external carotid artery. Secondary source is tensionar branch of the facial artery and ascending pharyngeal artery. Now go to the muscles of the eye. The muscles of eye play a number of vital functions such as movement of the eyeball, controlling the lacrimal apparatus and projecting the optic nerve. The muscles of orbital region are two major types: voluntary, involuntary. Voluntary, four recti muscles: superior rectus, inferior rectus, medial rectus, lateral rectus. Two oblique muscles: superior oblique, inferior oblique, and levator palpebrae superioris. Involuntary muscles: superior tarsal muscle, inferior tarsal muscle, and orbitalis muscle is involuntary muscles. Now the details of muscles. Recti muscles. The recti muscles originated from the common annular tendon which is attached to the orbital surface of the apex of the orbit. They encircle the optic canal and the middle part of the superior orbital fissure. All the recti muscles insert into the sclera. Superior oblique. The superior oblique arises from the sphenoid body and the passes through a fibrocartilaginous poorly attached to the cochlear fossa of the frontal bone. The muscles passes downwards below the superior rectus and insert into the sclera behind the eyeball. Inferior oblique. The inferior oblique arises from the orbital surface of the maxilla and insert posterior to the insertion of the superior oblique muscle. Now go to the levator palpebrae superioris. The levator palpebrae superioris originated from the orbital surface of the laser wing of the sphenoid and split into the lamellae, superior and inferior. The superior lamella inserted into the superior tarsus as well as the skin of the upper eyelids, and the inferior tarsus insert into the superior tarsus. Actions of muscles. The actions of muscles are distributed in details. Now the movements. The movements are upward movement, downward movement, medial movement, lateral movement, inward movement, and outward movement. Upward movement called elevation, downward movement called depression, medial movement called adduction, lateral movement called abduction, inward movement called intorsion, outer movement called extorsion. The movements of eyeball may be due to the action of single muscles or due to the combined actions of many muscles. Now the innervation and the blood supply of the muscles of the eye. Motor. The motor supply is through different nerves: superior rectus, inferior rectus, medial rectus, inferior oblique, and levator palpebrae superioris by the oculomotor nerve, superior oblique by cochlear nerve, and lateral rectus by abducent nerve. Vascularity. Vascularity is from the ophthalmic artery and the venous drainage is through the superior and inferior ophthalmic veins. At last but not the least, muscles of the floor of the mouth. The main muscles which from the floor of the mouth is mylohyoid. The mylohyoid is a flat triangular muscle that occupies the floor of the mouth. The mylohyoid of the both sides originated from the mylohyoid line present on the medial surface of the mandible. They run medially and little inferiorly to meet in midline. The anterior and the middle fibers meet in the median raphe and the posterior fibers insert into the body of the hyoid bone. These muscles help in the elevation of the floor of mouth, the depression of the mandible, and the elevation of hyoid bone. The motor supply is by the nerve to mylohyoid. Thank you.